Patients that are considering getting a penile prosthesis are always concerned about penile length. That's going to be the biggest concern. How long is it going to be, Doc?
Well, I go over always with patients a LGX and a CX, and oftentimes it's the patient who brings it up because they say, well, is this going to make me longer? I say, well, a LGX is able to expand in length and girth, and a CX can expand in its width.
They want to look at the device. I sometimes don't show them, but if I do show them, I like to show them the LGX because of the aspect of that pumps up and keeps on going lengthwise. I mean, that always looks good, both pre-op and post-op.
If a patient is going to get an 18 centimeter device or less, and I've shown with an artificial erection that they have a straight erection and they have pretty good elasticity of the tissue, then I think an LGX is a really excellent option. That's what we prefer, because then they can get some of the length that they've probably lost.
When describing the differences between the LGX and CX device, I usually bring it up for the men in whom I think a LGX device would be more appropriate.
So when deciding between an LGX and a CX, I like to discuss the LGX, especially with the patient who has a shorter penis, because the selling point is that it's going to have the potential of increasing length.
Knowing that they're going to lose 1 to 1.5 inches, they're very excited to find out that they have the potential to gain back a significant portion of that.
And so they will almost universally say, I have definitely lost 5 inches off of my penis, which is usually an overstatement. But whenever you can offer them a device that can increase and restore some of that, they are extremely happy with you.
So we leave patients about 50% inflated, and they stay that way for 2 to 3 weeks. They also keep the penis pointing up toward the umbilicus, because I think that really does allow for scarring that's in the most natural direction.
Post-op, I like to leave the device 70–80% in most patients.
When I talk to them about LGX, I explain that they have to be fully committed in the immediate post-operative period to cycling the device, because if they're not committed to cycling it, they're going to lose the benefit.
In patients who receive an LGX, we typically have them inflate the device and teach them to do so in the office about 3 weeks post-operatively. Once they become facile with that, we will have them inflate the device themselves at home for at least 30 minutes each day, and ideally 1 to 2 times per day, even if they aren't using the device for sexual activity.
I think it's great to have patients kind of part of the process. They need to accept some responsibility for their outcome.
As soon as they're able to cycle the device, I have them maximally inflate the device and leave it up for 15 minutes a day, every day, and I do that for 6 months. And I tell them that the onus is on them to take advantage of the LGX feature and try to get that device to expand in length and girth.
The feedback has been, you know, I've regained some of the length I've lost, and they're definitely pleased with it, no question.
I believe wholeheartedly that giving the patient the opportunity to regain as much length as they possibly can is very important, and I believe wholly and truly with the LGX model that it can maintain and or bolster length that has been lost.